How are you guys? So, for today, I will be sharing and mostly ranting about a very sensitive topic that I know that for some people who experiences this and who can relate to this prefers to keep to themselves. So what am I talking about? So this topic is about infertility. So just like Erik Erikson's stages of psychosocial development, tayong mga Pilipino rin pala ay merong stages na people are expecting us to be when we reach a certain age in life. So for example, when you reach the age of 20 or pagka-graduate mo ng college around 21 to 25 years old, mostly people are expecting from you. So mostly maririnig mo, lalo na sa magulang mo, is this question: tatambay ka na lang ba o maghahanap ng trabaho? So once naman na na-reach mo na ang 25 to 30 and you're already working but you don't have a boyfriend, people will ask you, magbo-boyfriend ka na ba o career ang atupagin mo? So these are the questions that people are usually asking, lalo na siguro sa mga reunion when you get together with friends or family. Yung mga tita mo tatanong sa'yo pag single ka pa is, kailan ka ba magbo-boyfriend? And then, pag meron ka ng boyfriend, sinama mo, ang tanong sa inyo, kailan kayo magpapakasal? And kung kasal naman and may asawa ka na, ang next question is, kailan kayo magkaka-baby? So these questions are usually a bit personal and sensitive, and they also pressure us to be on a stage that hindi lahat ng tao nakakarating ng sabay-sabay. And aside from the pressure, when asked by these questions, minsan nakaka-down, especially if you're doing all the best that you can. So for example, jowa ka na, pero lahat ng ma-meet mo at lahat ng makadate mo, hindi talaga kayo compatible. Or another example is if gusto mo na mag-settle down, pero yung boyfriend mo hindi pa ready or hindi pa nagpo-propose. And sa mga gusto magka-baby, syempre prepared na kayo financially, ready na lahat, baby na lang ang kulang, pero wala talaga, hindi talaga maibigay sa inyo. So ito yung mga bagay na nakaka-pressure but we have little to no control over. And most of the time, we don't talk about it openly to friends or to other people kasi hindi naman nila naiintindihan or ayaw nating mag-sound so desperate when talking about it. So for my case, it's the latter. It's infertility. So we have been trying to conceive for 3 years and we have been seeing a specialist. And I can say that we have done everything that we can. So we have tried to modify our lifestyle, our diet, yung timing, yung position. So lahat yan ng mga sinasabi nyo na gawin namin, nagawa na namin. Unfortunately, it's very difficult for us. Samantalang yung iba na aksidente lang na isang beses mangyari pero nakakabuo. So, yung diet namin, hindi na kami nagko-coffee, we're trying to eat healthy. Samantalang iba dyan, lasinggero or minsan nagtitake pa ng illegal drugs. Sila pa yung maraming anak, sila pa yung very fertile talaga. Especially yung mga teenagers na walang trabaho, asa lang sa magulang, hindi pa nakatapos ng pag-aaral. Sila pa talaga yung very fertile at kahit hindi nila gusto, nagkakaanak. Sana nga pag sinabi nitong mga marami ng anak na ayoko na mag-anak, give chance to others naman. Sana pag sinabi nilang ganon, yung mga walang anak naman na magkaroon ng anak, di sana lahat masaya, sana lahat may baby, di ba? It's not the case and it's not gonna happen. So para sa amin nahihirapan, it's very difficult, lalo na siguro sa situation namin kasi we have undergone all the blood tests, all ultrasounds, hormone levels, tubal patency, sperm analysis. So everything is normal. They did see a polyp which was surgically removed but after that, wala pa rin nangyari. So, hindi yun yung dahilan kung bakit hindi kami nagkaka-baby. So, mahirap on our case kasi hindi makita kung ano yung mali. Mas madali sana kung nakita na kung ano yung problem para mat-treat. Kasi for example, di ba, kunwari, block yung fallopian tube ko. So, alam na nila na iba-bypass yung fallopian tubes. Or for example, may mali sa sperm count or sperm motility. So, masasuggest na din nila to use assisted reproductive techniques para salain yung sperm. So, for our case, it's hard. So, personally, I feel that it's my fault. But sadly, I can't do anything about it. It's out of my control. Maybe heredity is a factor kasi may history din kami sa mother side ko na may ovarian cyst or may uterine myoma or fibroids. And meron din ako mga tita na hindi rin nagkaanak. However, this factor is something that I can control. So, it's very challenging to keep my hopes up. So, siguro sa mga makakapanood nito, you'll have different reactions and then you'll tell me na ganito gawin mo. Si ganito, nagkaanak, 40 years old na. I know that you would want to help and you would want to encourage me or to get my hopes high. Pero kasi before, when I talk about this topic with friends, in case na ma-bring it up, they told me not to worry about it and that si ganito, si ganyan, kakilala nila, may polycystic ovary or isa na lang ovary or merong endometriosis or 40 years old, 50 years old na, nagkaanak pa. I know you're just trying to help, but 30 plus years old pa lang ako and normal, hirap na nga ako eh. What more would waiting until I'm 40 help? I mean, will it increase my chances of getting pregnant? Di ba hindi? Mas lalo ngang bababa yung chances ko kasi advanced maternal age na. There's a higher risk of complications, birth defects, congenital anomalies, tsaka yung maternal risk mas tataas as I get older. Sa akin, hindi nakaka-comfort yung sasabihin nyo sa akin na si 40 years old na nagkaanak pa. Or, hintay ka lang, bibigay din ng Lord yan in 5 years. Yung 5 years na 40 na ako, yung 10 years na menopause na ako. At this time, kinoconsider ko na nga advanced maternal age na ako kasi I'm already in my mid-30s. So, I would like to have this happen na as soon as possible kasi I'm not getting any younger. So, yung mga sinasabi ng mga tao, mga friends ko na huwag ka masyadong mag-worry, kalma ka lang kasi 30 plus ka pa lang. I know you don't mean anything bad, pero para sa akin, hindi siya nakakatulong. Sa akin lang naman to. Siguro sa iba naman kasi tayo ng pag-iisip. Pero parang para sa akin kasi parang dinidismiss yung situation na I'm in. Like it's something na madaling solusyonan. It's very easy. For me, I'm just putting this out there para magkaroon din ng konting perspective about what we're going through and kung gaano kahirap yung situation. I know then na there's a lot of problems out there na mas mabigat, mas mahirap. And wala pa sa kalingkingan itong pinagdadaanan ko. For people like me, or ako personally, when I talk about this, gusto ko lang na i-acknowledge yung tao na I'm going through something and just listen. So I don't necessarily ask for advice or for personal opinion or i-compare ako sa ibang tao. But, ayun, gusto ko lang na mapakinggan. So, to let you know guys, bago kayo mag-react, I have undergone 5 cycles of ovulation induction with letrozole. Letrozole is a drug to treat breast cancer primarily, but it also has a side effect of stimulating ovulation. So, I've used that. And isipin nyo naman yung mga side effects ng mga ganitong gamot, di ba? So, that 5 cycles was unsuccessful. I have also undergone through 2 cycles of IVF, in vitro fertilization, or kung sa tinatawag sa Pilipinas is test tube baby. So, nakadalawa na ako and both were unsuccessful. So, it's very depressing kasi syempre parang IVF is a last resort na. Aside from yung cost, yung process is very hard. I think na you have to be emotionally ready as well as financially ready kasi medyo mabigat din siya. Thankfully, I'm in Australia and the government has helped a lot pagdating sa mga rebates and discounts. So, sobrang thankful ako na nandito ako sa Australia kasi kung nasa Pilipinas ako, hindi ko kakayanin yung pambayad ng IVF. Ayun, so, when you're going through this, mahirap, mabigat, and nakaka-depress siya syempre kasi yun nga yung last resort mo na yung IVF tapos hindi pa rin successful. So, you can't control it. There's nothing you can do. So, ayun, may mga ganong moment na down talaga. Ako nga, I personally think and I always say na I'm a strong independent woman pero dumadating pa rin yung time na sobrang down, depressed. Iiyak na lang ako or nakatulala, tumutulo ang luha. May mga ganong moments. If you have been through where I am and you have overcome this, kudos to you. Ang brave mo, girl. Ang strong mo if you have overcome this. And another thing, siguro napansin ng mga friends ko na hindi ako masyadong nag-socialize and also nag-refrain din ako from using Facebook that much. Kasi minsan yung mga nakikita ko, although hindi sinasadya, and it's not my friend's fault. Of course, they are free to post anything on their wall. They have their freedom. But personally, kasi minsan yung mga nakikita kong post, like for example, pregnancy announcement, or yung mga pictures ng mga babies, or yung mga challenge na I'm a mom challenge. Hindi ko maiwasan pero minsan may konting kurot. So, instead of magbabad sa mga social media, unless na maipopost lang ako na bagong upload or check my notifications, hindi ako masyadong nagfa-Facebook. Instagram, hindi naman talaga ako ma-Instagram. Actually ngayon, medyo napapadalas ang minsan. Kasi yun lang naman ang pinagkakaabalahan ko ngayon. So ayun, I hope na because of sharing this video, nagkaroon ng perspective at least yung mga ibang tao na hindi nakaranas nito, or lalo na yung mga support persons na sana makatulong sa ibang katulad ko na nagdadaan sa ganito. So on my next videos, I will be discussing more about the specific treatments and also the IVF process. I hope you guys samahan niyo ako sa aking journey, and I hope that this year will be a successful year when it comes to pregnancy. I just had my second embryo transfer done, which failed, and I think I am trying to move on. So I hope you guys enjoyed this video, and I'll see you next time. Bye!